One of my areas of interest is obviously psychosis. And psychosis we can broadly think of, there was a dichotomy or a splitting of mental illness into psychoses or psychotic disorders and neuroses or neurotic disorders. Neurotic disorders were believed to be understandable. A red car knocks me down, I'm now afraid of the colour red, and seeing the colour red makes me fearful. A neurotic phobic fear. Psychosis, however, talks about a detachment from reality. The problem was that, based on the work of Karl Jaspers, who was a philosopher and who worked in the mental health field as well, he talked about psychotic disorders as being meaningless and that their content was meaningless. However, the content of psychotic disorders is incredibly rich with symbolism, and so people like Carl Jung and Sigmund Freud and stuff that talked about that really symbolic nature of the mind, for me really speak to that. And I think the thing is that when we look at delusions are a subset of a psychotic phenomena. Delusions are classically defined as a false, fixed, firmly held belief that is outside the normal range of human experience. So whenever we look at these things, that in a sense they seem weird and unusual to people, but they're unshakable. A person cannot be simply convinced to change their mind about it. I've treated a number of individuals with psychosis, but particularly what we refer to as monosymptomatic delusional disorder. So one example of that could be body dysmorphia. So I had a young man who presented, and his fear was that he had female breasts, and so he wanted to go to a plastic surgeon and have surgery on his chest. Now, whenever I saw the young man, he had been to a number of different specialists. I write about this in my book. And effectively, he just wanted a letter from me saying that he was sane so he could take it to a plastic surgeon and compel him to do surgery. Now, when I looked at the young man, he was, entirely normal. There is a condition called gynecomastia where the male can have some breast tissue, and that can be influenced by hormonal influences, and it is obviously distressing and has a certain physical appearance which is upsetting. But for this young man, that was not the case. He was completely flat-chested, normal, no evidence of gynecomastia. But whenever I began to work with him using the EMDR method, we can allow the mind to float back to a point, we call it where's the ouch, where there's a dysfunctional memory network. And so for him, I was able to identify then an earlier trauma network. And whenever we reprocessed that in therapy, he then, over the course of 2-3 sessions, no longer believed that he had female breasts and was able to see it. He had, in fact, an entirely normal male body and chest. So there's something that should not have changed just through psychotherapeutic endeavor. But actually, that's exactly what we saw. And so I've seen that many, many times. Individuals who believed that certain parts of their body were disfigured or abnormal, people who believe that they've had a smell, people who believe that they're being spied upon, people who believe that their thoughts are being taken out of their head, and that other people can see them and hear them. So all of these different things are delusions which I've seen, but again, when that dysfunctional information is processed and when the brain allows to link in and associate, we see that many of these things go away. I'll always teach that EMDR will never make a true thing false or a false thing true. And so I always invite the person, well, let's work on it and see if it changes. And it's that very much working together. I do not try to persuade people that what they believe is wrong. I just invite them to allow their brain to process it and to notice what happens and how it changes.